Hi, everyone. My name is Lilian. Um, I use she, her pronouns, and I'm here to talk about my project called Health in All Projects, which was created to build health promotion into project management processes at the BC Children's Hospital. Today, I'm calling from the traditional territories of the Mississaugas of the Credit, the Anishinaabeg, Chippewa, Haudenosaunee, and the Huron-Wendat peoples, otherwise, or what is colonially known as Toronto. It is a beautiful sunny day here, even though you can't really tell from my background. And I'm very grateful to have the opportunity to live and work here and call this place my home. I was incredibly fortunate to have completed my practicum both remotely and in person within the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. So just a quick overview of what I'll be going through today. I'll be introducing the team that I've been working with, going through my project, the methods and the frameworks that guide it, and also the two project outputs, which are the educational resource and the health promotion capacity assessment tool. And then finally, I'll be reviewing some additional considerations and limitations. Who is HP squared? So the HP squared stands for the Health Promotion and Projects team. They are housed under the Greater Health Promotion and Health Literacy team within the BC Children's Hospital, and they manage a wide range of programs and projects. And so to give you a better idea of what programs this team manages, some examples include the Dental Project, which is an initiative that works to increase access to oral care services across BC. And you take that in contrast to something like the Space Utilization Project, which is also a project they manage. And this project assesses current physical space usage across the hospital campus. So as you can see, this team truly manages a wide variety, a hodgepodge of projects across the hospital campus. The team itself is made up of project managers with diverse educational backgrounds and work experiences, some of which are within the field of health promotion and some of which are not. And so this has resulted in the team having varying conceptions of what health and health promotion means, as well as a very black and white understanding of whether or not their projects are considered health promoting, such as the classic health promotion type projects like the Dental Project, or not health promoting. And these typically stem from more non-health sectors or departments like operations or facilities management, such as the Space Utilization Project. And so this brings us to the issue my project is trying to address, which is if project managers don't recognize their projects as health promotion projects, then they may miss out on the opportunity to use their projects to enhance health and health equity within the hospital setting. Secondly, there's also this dominant biomedical way of thinking that focuses health promotion action towards more individual level training and education, which actually draws attention away from the root causes of health issues that stem from the broader social and political systems and structures that we live in. So my project, Health in All Projects, is really a first step in a larger objective to integrate upstream health promotion considerations into project management processes. So ideally, we want project managers to understand that health promotion is truly inherent in all projects across BC Children's. The methods for my practicum project are pretty straightforward. We started off with focus groups to assess the team's level of understanding of health and health promotion, given their diverse knowledge bases. We also took the opportunity to use the focus groups to develop a team definition of health promotion that's specific to the context of the team as well as the work that they do. And this team definition was then used as the foundation upon which my project was then built off of. Next came the literature review. So I reviewed existing gray literature and scholarly peer-reviewed journals to see what health promotion tools existed, which can be used in the project management space, as well as what health promotion frameworks can be applied to this specific context and used as guiding frameworks. And next came the development of the resource and tool. So I mentioned earlier, my project has two outputs. The first output is an educational resource that provides foundational knowledge about the determinants of health and what causes health and illness. And we used different frameworks to help with this. Now, one of my goals is to build in Indigenous cultural safety throughout my entire project. So when thinking of frameworks, I really wanted to draw from both Indigenous and Western perspectives using a two-eyed seeing approach. So from the Indigenous side of things, we drew from the First Nations perspective of health and wellness, which is a visual depiction introduced by the First Nations Health Authority. And then from the Western side, we drew from a socio-ecological model that's been adapted specifically to the BC children's context. And project managers are encouraged to use both frameworks as a way to start decolonizing the ways they understand about what causes health and what causes illness. And so you'll see on this slide here are some screenshots of my educational resource. It's essentially a 5-page PDF document that provides a glossary of terms, so it defines key pieces in the team definition. It also provides examples of how to use each framework to link health promotion to project management. And then the crux of the resource is really 4 practical steps that can be used to apply health promotion to projects and also to promote health through projects. And then my second output is a tool, and this tool is called the Health Promotion Capacity Assessment Tool. And this tool allows for the operationalization of these 4 steps. And so you'll see the 4 steps on the slide here. The way we operationalize these 4 steps is by incorporating them into the project charter. So the project charter is essentially a project planning document that project managers use that outline all the aspects of a project. And the thinking is that by incorporating this tool into the project charter, project managers are then prompted to think about health promotion from the project's inception and then build in health promotion into all the subsequent parts of the project as well. And so after project managers work through all of these steps, by the end of the last step, the hope is that they will come up with new health promoting objectives that can then be incorporated into the project's final objectives. And then the last part for my practicum project is to gather some informal feedback. So initial feedback was obtained from the HP Square team as well as the Indigenous Health team. Both of these teams have project managers that will be using the resource and tool. And then any feedback that we received were then incorporated into the final versions of both documents. And then finally, some additional considerations, including limitations. First, health in our projects may still bias Western perspectives. Even though efforts have been made to embrace this 2-eyed seeing approach, we can't fully exclude the possibility that Indigenous perspectives were inadvertently decontextualized from its original intention and then reinterpreted through a Western lens or through Western assumptions. And to take things one step further, the First Nations perspective of health and wellness depiction is not really representative of all First Nations perspectives, nor is it representative of all Indigenous perspectives either. So future considerations will definitely include efforts to incorporate additional Indigenous perspectives, such as Coast Salish teachings, along with Métis and Inuit perspectives on health and wellness, so that subsequent iterations of health in all projects are more culturally inclusive. The second piece is scope creep. So incorporating additional health promotion objectives often means that a project requires more time and more resources, and this can place additional strain on project managers who have to meet certain deadlines or have to stay within a restrictive budget. Upstream health promotion strategies are likely outside a project manager's usual scope and will require a combination of additional organizational support, leadership buy-in, and intersectoral and interdepartmental partnerships, which may prove to be a substantial barrier to the true operationalization of health in all projects. And then finally, lifestyle drift. So this is the tendency for policy to recognize the need for action on upstream determinants of health, but still end up drifting downstream in their outputs or their actionables. So in order for this project to really meet its goals for upstream action, it will require more buy-in from organizational leaders and partners to combat this lifestyle drift. And last but not least, I want to say a huge, huge thank you to the HP Squared team and to my supervisors, Shar and Caroline, who are on this call right now, which is just a testament to how supportive they've been. This is a photo of our team building activity that I was invited to, where we did splatter painting. I also want to thank Victoria and Natalie for being very supportive during the course of my practicum. I'm just really, really grateful to have had such a supportive environment to carry out my project.